everyone, I'm Dan and I have Dr. Bilski here from Bilski Dental Group in Independence. And there's a lot of concern out there around COVID-19, as you guys know. And how does that really play into dental care and everything else? So what do you think here?
Yeah, first of all, going to the dentist, it's a scary thing.
Mm-hmm.
And in the times that we're faced with right now with the COVID-19, Governor DeWine, we're in the state of Ohio, is recommending that no elective procedures in dental are done. So that means cleanings, no cleanings. Recommendation of no cleanings actually should be taken from all dental healthcare providers as the rule. It really is the rule. The terminology of recommendation is a suggestion that was last week. Now we're seeing more procedural things being discontinued. No elective surgeries, no cosmetic dentistry, no whitening, no bonding. You have a cracked, broken tooth, front, big smiley tooth. It's not something that we're going to see right now. So that's scary in the event, what if you do have a big toothache? In our practice that we've been taking care of pain, swelling, bleeding, infection over the last 32 years in my office.
Hey, I'm sure that you've seen, are there people that come in that literally look like they can't handle it anymore and they really need the procedure? Like, what does that look like over the past 30 years for you?
General malaise. We have the droopy eyes. If you have children, you know yourself when you're sick and you just look in the mirror and you have your eyes. They're just not the same bright eyes that you normally are used to. Patients with dental pain, even without swelling, even without obvious x-ray detail, they're in pain. And if you've ever had a toothache, you know exactly what I'm talking about. There's no other pain worse than nerve pain. And it's not just limited to the teeth. It could be back, it could be neck. It's pain. So when you have a toothache or a broken tooth and your tongue is being lacerated every time you eat or talk, it's painful. And that creates an ulcer. You create an ulcer, you have a viable highway for infection, bacterial or viral. So we'll talk a little bit more about that.
So with this COVID-19, we don't really know if someone's going to have to sit there for a month, 2 months, 3 months with this pain. So you've come up with a solution. Do you want to talk about that?
Every day is a new solution. So how we were handling this last week, when President Trump mandated that this was a national emergency, we were just doing business as we knew it. Then as we got into the weekend, there was the escalation of, hey, let's get some provisions and make sure that you're set because we don't know what's going to happen. On Monday, Governor DeWine sent out an email to all the dentists through the State Dental Board of Ohio with the recommendations of what we should do. Now we're at a point where we have to be careful with the masks and the gloves that we're utilizing in our own practices. So it is limited in so many things that we can do. So to say exactly what we're going to do with it, it is certainly a day by day in which this is an unusual circumstance.
For everybody.
For everyone. I've been in this practice, in this business for 33 years starting. I also had 4 years of dental school, and we got to talk about 1984, 85, 86 when HIV/AIDS came out. We really didn't know about anything, and believe it or not, I was actually cleaning teeth as a neophyte in the dental school without gloves, without a mask. Then it was mandatory, and I could be wrong on the date, about 1986, that we were required to wear masks and gloves on procedures that we were touching saliva. And I don't know any dentist in this United States that doesn't touch saliva at least one time. That being said, what can we do? And that was your question. We have developed in Independence, Ohio, a protocol. We're talking about using technology, digitizing things with virtual cell phone communication. Or if you are a laptop person or you have a camera on your desktop, you can actually go to the link, request an appointment virtually with our practice, and talk to me. Dr. Timmerman is also with me. And well, let's talk about this too. We also have other doctors in the area that aren't seeing patients. They're just shutting down shop.
Right.
And in particular, a dental emergency in our area, or what I deal with over the last 32 years, has been tooth pain, which is a root canal.
Right.
The other alternative would be to remove the tooth, extract it. We're not in this situation forcing patients to accept what we tell them they should do. What we're suggesting is what you could do is nothing.
Yeah.
What you should do, and let's just use the root canal, that is the optimum therapy or treatment that is best for you. And then we're going to put a post-it in or support the tooth so you can kind of walk around and have something stable to chew with, or not be in fear of breaking it. So that's what you should do. Or you could do the extraction. It really is up to you. So under duress and in this time of stress, we're not forcing anybody. What we're trying to identify, eliminate the fear of what is going on. People are afraid right now.
Oh yeah.
I have staff members that aren't working.
Right.
They're just afraid. They're not.
We do too.
And I have a mother who's 82. God bless her. She's healthy. And we're just staying away from mom. I love her. The last thing I want to do is have me or my children give my mother a hug.
Yeah.
And it may be the last one because the potential for transmission. Now, that being said, I don't believe that that's going to be the case because we are following social distancing, which we'll talk a little bit about. How do we move from the virtual examination into, well, I think I should drive to see Dr. Bilski and Dr. Timmerman. So that we can evaluate you, and we'll go through the steps on that, and also look
at the steps. And just to let everybody know here too, to put this program together, we have really all kind of volunteered our time and personal investments to bring this service to the general public, so that it weren't, there's no motive here outside of just trying to help people. And
that's a very good point. Mayor Greg Kurtz from Independence, Ohio, has definitely supported our practice. Currently, right now, we're working with the city. They're going to post this very thing that we're talking about within their own website. So if you're in the city, it's not limited to Independence. We're actually going to go out maybe 100 miles because we do know that there's a lot of dentistry not going to be done in an emergency situation. And then we have the facility and the capacity to take care of it ourselves. And if we become more overtaken by these emergencies, I have the capacity to bring other doctors in that provide root canal procedures and go through the same process.
And you were even saying bring doctors in from 3 hours away if you have to.
So that's correct. So it's kind of like we're going to close the practice. Dan, you work for me. I'm sorry you can't work, and we're closing shop. So whatever you choose to do, you're not going to find another job. Well, the doctors that are closing, that are unable or unwilling to practice, there are staff members that are comfortable helping in emergency situations. So we would actually, I wouldn't say negotiate, but offer those staff members to come up. And if they wanted to drive however many, 2-3 hours, we're okay with it. We need bodies. We need bodies.
So in a lot of ways, you're assembling on the dental side what the hospital systems have done on their side, right? You're kind of taking the stance to you're stepping up and you're saying, you know what, I can close my practice, or I could try to create a program for people that are sincerely in pain, and you're stepping up to the plate to help them out. So let's go through the program itself. Unless there's anything else you want to share.
I'm just going to add to things that you mentioned as we're talking through this. Again, we got to remember this is all new. We're working with the medical experts from the United States, which trickles down to our governor. From our governor, we get through the State Dental Board of Ohio. They tell us this is kind of what we're looking at. And we're a triage center, not to be confused with coming in for, and I'm not trying to minimize a broken tooth. If it's broken and it's in the back and you can't see it and it's just a little sharp on your tooth, you just have to be careful. And that's not our focus. Our focus is on swollen faces or pain, infection that you can actually see, or bleeding, and certainly trauma.
Right.
We're there to help that.
Right.
So pain, swelling, bleeding, and infection, and not always is it obvious. Just like the hospitals are saying, if you have a fever, cough, do not come to the hospital.
Right.
Call your primary care. Call somebody that that is a physician, clinician that works in that realm to identify the symptoms. We're saying the same thing with teeth. Pain, swelling, bleeding, trauma, infection, 5 things. We do a virtual examination via cell phone. It's real simple. You request an appointment through our website.
So if you guys are interested in this procedure, just click the button right below and get this process started. Thank you.
You're welcome. Thank you.